With an aging population and a growing prevalence of dementia and cognitive decline, the need for effective solutions has never been greater. But there's a catch. Navigating the complex landscape of funding and development in this field isn't easy. How can we ensure that the best ideas get the support they need to make a real impact? What role do digital health technologies play in transforming the lives of those affected by dementia? And how do we bridge that gap between groundbreaking research and practical, scalable solutions? With me today, I'm joined by Dr. Kaele Stokes from Dementia Australia, Dr. Amanda Vrselja from Brandon Capital, and Kim Smyth from ANDHealth. And in this episode, we talk about the significant funding opportunities available for health tech innovations in dementia and cognitive decline, including how entrepreneurs and researchers can tap into this support. The CUREator Plus program and its unique approach to fostering collaboration between digital health, therapeutics, and medical devices to address the challenges in dementia care. And the critical role of Dementia Australia in ensuring that the voices of those living with dementia and their carers are heard and prioritised in the innovation process. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
Kim, Kaele, and Amanda, thanks so much for joining on the podcast.
Thank you. Thanks for having us.
Yeah, thank you.
It's great to have people from different organisations talking about an important topic, an important area in healthcare, but also how to actually do it and fund it. So I'm keen to dive in. Before we really get into the nuts and bolts of it all, I might get you each to tell us a little bit more about who you are and what you do. Kim, let's start with you.
Yeah, sure. I'm the GM of investment for ANDHealth. ANDHealth is a digital health commercialization program that works across Australia. And I lead the ANDHealth Plus program, as well as partner with Brandon Biocatalyst for the digital health component of the CUREator Plus programs.
Excellent. Thank you. And Kaele, what about yourself?
Hi, everybody. I'm Kaele. I'm the Executive Director of Services, Advocacy and Research at Dementia Australia. So I have responsibility for all of the services that we deliver to people living with dementia and their families and carers, all of our systemic advocacy, so the work that we do with all levels of government and people that are living with dementia, families, carers and communities to facilitate systemic change. And then I also have responsibility for the Dementia Australia Research Foundation, which is a separate but related entity to Dementia Australia, which provides predominantly early and mid-career research fellowships and grants to our research community to make sure that we're continuing to support our emerging researchers focusing on dementia.
Yeah, so important. Looking forward to diving into that in a sec. And lastly, Amanda, introduce yourself, please.
Thank you. Hi, everyone. I'm Amanda Vrselja. I'm the Program Head of CUREator, which is a national biotech incubator run by Brandon Biocatalyst. We focus on accelerating the development and commercialisation of early-stage biomedical innovations in the country.
Excellent. So, Kim, we've got the right people in the virtual room right now to talk about this important topic. Help me understand a little bit more why we're here and what we're unpacking.
I think what we want to do is get the word out about a new national program, which is focused on accelerating research translation and commercialization in the areas of dementia and cognitive decline. We'll talk a bit more about that program, but really want to reach out to entrepreneurs and visionaries in your audience or their networks who have proof of concepts across digital health, therapeutics, diagnostics, assistive technology, or medical devices that can help people living with these conditions. There's $50 million of funding available across the program, up to $5 million per company. And these can be businesses, researchers. Innovation and impact, we understand, can happen from anywhere. So we want to get the word out.
Excellent. And so important and timely, and often with these great solutions, the funding's required to kind of get it off the ground and the right people to hear it and use it. And as I understand, there are important programs to facilitate, I guess, some of this funding. I'd love to learn a little bit more about in particular, the CUREator Plus program, Amanda. You touched on that before. Tell me a little bit more about what that's about.
Yeah, I think I'll take a step back and just build upon what Kim was saying. And I think, just to recognise that Australia is home to some of the world's leading neuroscience research and innovation. And so we're really excited to be delivering a program like CUREator Plus for dementia and cognitive decline that's really tailored to expedite their advancement from sort of their idea, groundbreaking research innovation through their creation into, the commercialisation journey. So this program, CUREator Plus, is really focused on building those translational skills, but also making them commercially attractive. And so with the support of funding from the Medical Research Future Fund, as Kim mentioned, this $50 million partnership, which is between Brandon by Catalyst, which is managed by Brandon Capital, Australia's leading life science investment firm, ANDHealth, as Kim introduced, Australia's leading digital health organisation, and also Dementia Australia, which is the national peak body for dementia and cognitive decline. And I think this is a really important partnership to bring together the funding, but also to focus on getting, ideas into potential products and therapies for those who need it the most.
So I think about some of these programs that exist. You've got your incubators, accelerators, you've got your commercialization side, and sometimes it's about having a lot of information available. Sometimes you got your the support that's provided. What are some of the things that participants might do in terms of going through this program, and what kind of resources might they access?
Great question. So as a national incubator program, not only are we providing funding, but we're also providing access to a number of other mechanisms to help the translation and commercialization of these projects that do get funded. So from the funding that we do provide, it's delivered in tranches, and they're tied to mutually agreed upon milestones to assure that these projects that are going along this journey are achieving that data value-adding package that they need, or de-risking the program to take that next step. Beyond that, the relationship with Dementia Australia is really important. We'll have continually strong community and consumer engagement throughout the program. So it's not just at the beginning, it'll be continuing throughout. I think that voice is really important to ensure that these projects are addressing the breadth of the patient, carers and workforce needs. But then through the relationships as well of all the partners on this call, we're able to tap into local and international expertise. And so whether that's clinicians, whether that's accessing particularly regulatory advice, or, someone with a special skill that you haven't been able to address it within your innovation and a gap, you're able to access those support, but you'll also have support from the project management side, hands-on as well. So I think from that perspective, it's quite hands-on, and ultimately bringing all of these, funding incentives and also program progress, the opportunities towards the end of the CUREator Plus Dementia and Cognitive Decline program will be positioned to, go and get follow-on funding, partnerships, generate revenue wherever they're at in their sort of development journey to continue that to get into the patient's hands.
Yeah, got you. Excellent. And Kaele, that these issues around dementia and cognitive decline, I'd love to learn a little bit more about why it's such a priority in Australia to focus on.
Well, I mean, this is a very timely conversation, because we know that there's more than 421,000 people living with dementia in Australia at the current time, and about 1.6 million people involved in their care. And in the next 20 or 30 years, that number is going to more than double. So it is, often when you talk to different audiences, you find that about 3/4 of the room generally will have a direct experience of dementia themselves. So they might have it in their family. They may have a family member or a friend that is impacted by dementia. And yet it's still something that we really don't understand a huge amount as a community. There's still a lot of misunderstanding, a lot of stigma around it. And ultimately, we're in a situation now where there's so many people that are impacted, but we don't, as a community, as a society, even as a workforce, necessarily have the skills that we need to be able to support people through high quality dementia care. And so I think that these sorts of initiatives are so important, because we are really at the tipping point in terms of building the capacity of our workforce and our healthcare and our aged care systems to be able to support people living with dementia. I mean, more than 2/3 of people living in residential aged care will have a moderate to severe form of cognitive impairment. And although most people living with dementia live in the community, their experiences of healthcare services, of community-based services are variable. And we often find that people will have extenuating circumstances. They'll have longer hospital stays. There's higher levels of complexity. And when the wheels really fall off the system, we see people, the police are called, or ambulance, or there's an escalation of emergency situations that could be otherwise avoided. So there's a whole range of opportunities for us to do better in this space. And I think technology is a really important facilitator of that.
Well, I was thinking as you were saying that too, I think you said nearly 500,000 people, affected by this now, and it's an increasing issue. And so, but an area that we still... there's so much more to learn about the space around dementia and cognitive decline is what I heard.
Yeah.
So on one hand, I would think if there was a lot of investment available, then the investment should go to research to understand it more. But we've got so many people living with it now that there's those support services that are required. What are some of those support? So what do people need? Is it, I'm thinking, carers? Is it education? Is it a little bit of everything? What?
It's a little bit of everything. So we have a range of services and supports available for people living with dementia and families and carers. But really, some of the work that Dementia Australia does looks at that kind of intersection. So for somebody trying to get a diagnosis of dementia, it can be incredibly challenging. So, if you look across the trajectory of the disease, there are all sorts of areas where there are opportunities for improving an experience, And somewhat unfortunately, we're starting at a low base in terms of the quality. So, but it does mean from a service improvement and from a technology opportunity, there are a huge number of opportunities to start to improve everyone's experience. So getting a diagnosis can be incredibly challenging. The average time is still about 3 years for a diagnosis of dementia for an older person. For somebody that's living with a form of younger onset dementia, that is a dementia that's diagnosed before the age of 65, it can take a lot longer because the diagnostic process is complex. It's not straightforward. It's not linear. And it can take multiple engagements with different healthcare professionals to get that diagnosis. Being able to support somebody at the point of a diagnosis to understand how they can prepare for the future, to understand how they can live well and make decisions while they still have capacity and autonomy is an incredibly important part of processing a diagnosis. Talking honestly with family members and with friends around your wishes, the sorts of things that none of us as a society are particularly good at having conversations about, are particularly important if you have a cognitive impairment, because you need to have those conversations earlier on. So having that kind of engagement, being able to understand how a diagnosis can change the dynamics within a family environment, understand how communication styles may change, relationships will look different. Having support, whether that be counselling or group programs or peer support that can help you to process that, can make a huge difference. Planning for the future, looking at the sorts of care options that you might need ongoingly. So it might be sort of lower level community-based services or support groups or carer support groups through to residential care and also palliative care. And focusing on what's required across that trajectory can be a really important component of planning for the future. And as I say, none of us are very good at talking about that, but they're really important conversations to have. And then having ways of being able to engage effectively. We often hear from people living with dementia that social isolation is a key element of their experience. Partly self-imposed if they feel awkward or they feel concerned or nervous about going out into their own environment. They're worried about getting lost. They're worried about saying something embarrassing of their friends and family, not wanting to spend time around them. But also people feel awkward and don't necessarily want to engage. So being able to find ways of facilitating meaningful engagement with somebody with a cognitive impairment right along the trajectory can be really important. Even somebody who is not able to speak, effectively or put together sentences can recognize body language, can recognize tone. There's a whole range of things that we can do to ensure that people know that they're supported and cared for, even if that's, through nonverbal communication. So I think there's a whole range of challenges, but also opportunities. I try to be optimistic and flip it and say that, although there are a lot of challenges for somebody that's got a diagnosis of dementia or a family member or carer or a professional carer, there's also an enormous number of opportunities to improve things.
I was just going to say, after COVID, we saw this sort of, or throughout and afterwards, this kind of blossoming of digital health technologies kind of come to the fore, right? And we need to kind of continue that, I think, level of innovation and focus on the community, whether it's solutions to help in any of those areas that Kaele talked about. But we do see some major trends around care moving closer to the home, engaging more with the community, as opposed to just thinking about the patient, looking at, how AI or VR, a number of technologies can be kind of brought together, but with that human-centered design focus. So it's not just trying to impose a solution. One of the exciting, I think, features about this program and why I think as part of CUREator, Amanda and I are so excited to be partnering with Dementia Australia is that they will be leading a community steering committee to help evaluate proposals, really with the people living with dementia, their carers, the workforce, their families and their communities, all having that voice in selecting what the best ideas are that should be taken forward.
And I think about the issues that Kaele outlined with the impact that dementia and cognitive decline have on people, and some really important things that are most critical to just human existence in terms of relationships and functioning on the day-to-day has a material impact. I can understand how it's such a big issue to address. And Amanda, from your side, I just think broader about the brand and visibility in life sciences and problems to be solved. I can understand after hearing Kaele outline some of that, and also to the points that Kim made about some opportunities to address them there, that I can see how this is such a critical issue from your side too.
Yeah, of course. And I think that's why we're really excited about this program that's going to support a number of different type of innovations, whether it's digital health and assistive devices to, have that shorter term immediate impact for people living with dementia and cognitive decline, or their carers or the workforce, through to, novel biomarkers to help diagnose and, identify potentially signs of dementia earlier in life, all the way through to therapeutics to help manage, slow, treat the symptoms of dementia and cognitive decline. So I think as a program, there's impact on many different levels. And until we fund these programs, obviously we can't talk about what or know what these projects would look like. But I think that's the really exciting thing, that this has a huge impact on a specific area of focus that does need a lot of help and support. And, hearing those stats from Kaele, which we all know so well, just to know that, almost 500,000 Australians are impacted by this disease, and the huge amount of support network that there is a real need and push for that acceleration of the commercial part for these innovations to become actual products.
Yeah, absolutely. And look, we are starting from a good base in terms of, the level of engagement and research expertise in Australia is really remarkable. So, we have got some exciting collaborations already, starting to bubble away. And I think it does give us a huge amount of opportunity. I think the other thing to note as well is that, with dementia, often people think about it as a disease of memory loss. But the full spectrum of diseases that causes the kind of collection of symptoms that we know of as dementia, there's more than 100 different diseases. And so the experience of dementia is not just always about memory loss. It can be around visuospatial awareness. It can be around balance. It can be around mood and behavioral disturbances, hallucinations. There's a whole range of different symptoms that we often don't tend to think about with dementia. So, that means that when we're looking at solutions, it's important not to just sort of get focused just on things around memory loss, because there's a whole range of impacts on somebody living with dementia, and that does mean that there's incredible opportunities. And because we have access to people that are living with dementia and their families and carers as part of this collaboration, it means that we ground everything back into the experiences of those living with dementia and families. And that's really important, because there are very accurate and clear litmus test on particular ideas. So, obviously we can go off and think about starting to develop ideas in a particular area, and then you start to share that with someone who has a living experience, and they kind of bring you back down to earth and say, well, that's not going to work, or that's actually not dealing with the most pressing issue, or that's an amazing idea and that would make a really significant difference to my life. So it's an incredible engagement, and when it's sort of that genuine kind of co-design approach in terms of developing ideas in conjunction with people that are living with dementia or families, it creates such a rich end product.
Yeah, absolutely. And I'm glad you made that clarification about, whilst it's much more complicated, intricate, other than just memory, and that, and I think that's important too, as I think about technology solutions that exist currently or that can be adapted, and someone might kind of think that they may not be able to have an impact in an area like dementia and cognitive care. Understanding that broader issues that exist is can be important, because there's a lot of innovative ways to address some of these problems at scale, and I think technology it makes a lot of sense to do that. Kim, is that kind of the same thinking from your side? Because there's a lot of ways we could invest in trying to address some of these issues, but it seems we're really leaning into technology here to address them, just because we've got the problem that's at scale and that it's continuing to broaden out.
Yeah, well, I think the CUREator Plus program, and this one as well, is looking almost across all modalities, right? So we're looking for the best innovation, and the things that will have the highest impact and that we could most help through the program to get to that scale or accelerate their availability to Australian patients in the community, right? So I don't think we're focused only on technology, although maybe for this audience, I think technology does, as you say, have a really important role to play, not only in, I think digital, like long-term, has this ability to kind of scale beyond what, just human can, but also it can support some of these other innovations, right? So for example, if a new medication comes up, but how do you get it to the patients? How do you identify them? What sorts of diagnostics? Some of those will be biological diagnostics. Some of them may be digital, medical imaging and so on. So I think by looking at all of the kind of innovation, there are specialty elements for each one, but there's also a great interplay between them. And we've certainly seen that as we've started this collaboration.
Yeah, excellent. And so thinking about the program specifically, Amanda, the CUREator Plus program, who can apply for it? What's some of the nuts and bolts of what this looks like?
Yes. So if you are listening, you're probably an innovator, an entrepreneur, or you know someone who is. So firstly, I would encourage you to go to the Brand by Catalyst or ANDHealth websites to see the funding guidelines and more information on how to apply. But this is a program that's designed to, support these innovations to get to that next stage in their commercialization, translation journey. And so as a result of the funding, we need to support companies. And so, the funding will go to SMEs, but on the other side, we know that there's a lot of brilliant research that's still in the labs, or still maybe in someone's garage. And so on that point, we do allow people to apply without having a company formed, but appreciating that they will need to form one if they are successful for funding. So that's sort of the main hurdle it is for Australian opportunities that do really want to address the challenges that are faced with dementia and cognitive decline and have commercial potential in their opportunity. And I think it's quite open and broad to, as we've been discussing, what kind of innovations, what stage of development we're looking to support, but ultimately with the bigger picture of improving lives.
Yeah, excellent.
I think one question we sometimes get asked is, do you have to have already had experience of, say, an ANDHealth Plus program or an ANDHealth program, or Do you have to be in the Brandon network? And we just want to make clear that no, you don't, right? We're trying to get the word out as broadly as possible. As Kaele says, some of the best ideas come from people who are embedded in the community and kind of living with the problem intimately. So, so we just want to get the word out as broadly as possible. Really, the only requirement is this: either that you are a small or medium enterprise in Australia, or that you are willing to become one.
And look, if I'm putting my feet in the shoes of that SME that's in Australia that's listening to this and it sparked their interest and they're keen to dive into the details and learn if they're eligible and apply, Kim, how are they going to do that?
Well, we have, as Amanda said, we have a lot of information, FAQs on our website, on the 2 websites, which we'll provide in the notes here. We also have a recording of a bit of an informational webinar that gets into eligibility, but both organizations are also providing one-on-one office hours. So if you're not sure after having read that and you want to have a chat with a member of the team, we can spend up to half an hour with you just to understand, are you at the right stage? What is your link to dementia and cognitive decline, and give you some guidance.
Fantastic. Yeah, well, we'll put the details in the show notes of this episode and people can click through and learn that or see that on our website. Great opportunity to solve some really important problems and timely as well. So Kim, Amanda, Kaele, I really appreciate you making the time to come and have a chat on the show. Thanks so much.
Thanks so much for having me.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.